This is a question many overseas Vietnamese and international patients have been asking in recent years because today Vietnam is no longer just a travel destination. It is gradually becoming one of the most attractive destinations for dental treatment in Asia. Many people from the United States, Australia, Canada, and Europe are choosing to come to Vietnam for dental implants, not only because of the lower cost, but also because of the advanced technology, highly skilled dentists, and more flexible treatment schedules. But the important question is it really worth it? Is it safe? And if you are considering coming to Vietnam for implants, what should you carefully check before making a decision? In today's video, I want to share a very honest and practical perspective from the point of view of an implant dentist, so that after watching this video, you will be able to decide for yourself whether Vietnam is truly the right place for your implant treatment. First of all, let's be honest. Cost is usually the first reason why people start researching dental implants in Vietnam. Let's take a real example. In countries like the United States, a complete dental implant for just one tooth can cost anywhere from $2,000 to $6,000 USD. If multiple teeth or a full mouth restoration are needed, the total cost can easily reach tens of thousands of dollars. Meanwhile, in Vietnam, even when using internationally recognized implant systems, the cost is often significantly lower, and this is something that surprised many people. It is not necessarily because the materials are lower quality. The main reason is that operational costs in Vietnam are much lower. Clinic expenses are lower, labor costs are lower, and the overall healthcare operating structure is more affordable. However, the implant system themselves can still be the same internationally trusted brand, such as Straumann from Switzerland, Nobel Biocare from the United States, Osstem from South Korea, and many other globally recognized implant systems. In other words, you may receive the same international implant brands, but at a much more reasonable cost. That is why many overseas Vietnamese jokingly say, flying to Vietnam, enjoying a vacation, and getting implants done can sometimes still cost less than treatment in their home country. But affordability alone is not enough. The more important question is the quality of treatment actually good? And the answer is yes. Many dental centers in Vietnam today are equipped with highly advanced implant technology. For example, 3D cone beam CT scanners that allow precise analysis of bone density and nerve positioning, digital intraoral scanners that replace traditional uncomfortable impression materials, guided implant surgery systems that improve precision and minimize surgical trauma, and CAD/CAM restorative technology that creates highly accurate and aesthetic dental crowns. In fact, many modern dental centers in Vietnam are updating their technology very quickly, in some cases even faster than smaller private clinics in other countries. Why? Because Vietnam's implant market is growing rapidly. There is high demand, a large number of implant cases, and strong competition among advanced dental centers. As a result, many clinics heavily invest in technology and treatment quality. However, this is a point I really want to emphasize. Advanced technology alone does not guarantee good results if the dentist lacks experience and expertise. Dental implants are not simply about drilling and placing a screw. Implant dentistry involves jawbone anatomy, bite function, facial aesthetics, gum tissue management, nerve positioning, and long-term chewing stability. Some cases may appear simple from the outside, but if an implant is placed just a few millimeters incorrectly, the patient may experience persistent pain, bone loss, peri-implantitis, or poor aesthetic outcomes. I once treated an overseas Vietnamese patient who had implants done at a very cheap clinic. When they later returned to Vietnam for evaluation, the CT scans show that the implant has been placed dangerously close to the nerve canal. The patient experienced numbness in the lower lips for several months. Eventually, the entire implant had to be removed and redone. And in many situations like this, correcting a failed implant can cost far more than doing it properly at the first time. That is why the most important factor is who is treating you. So if an overseas Vietnamese patient or an international patient wants to come to Vietnam for implant, what exactly should they check? Let me share 5 extremely important things. First, check whether the dentist is truly specialized in implant dentistry. Do not rely only in advertisement. Look deeper. Does the dentist regularly perform implant cases? Do they have real clinical examples? Can they explain your CT scan and bone condition clearly? Do they provide a detailed treatment plan? An experienced implant dentist usually does not rush treatment. Instead, they carefully analyze bone quality, implant stability, potential risks, and the long-term prognosis. Second, evaluate the clinic technology and facilities. A professional implant center should ideally have 3D condom CT, digital scanning system, sterilized surgical rooms, a structural treatment and follow-up system. Because implant treatment requires extremely high precision, it should never rely only on experience and estimation. Third, check the origin of implant system. This is something many patients overlook. Ask clearly, what implant brand is being used? Is it authentic? Does it come with an international warranty card? Remember, an implant will remain inside the jawbone for many years. You deserve to look exactly what is being placed inside your body. Fourth, ask carefully about treatment planning for international patients. This is extremely important for overseas patients. An experienced clinic that regularly treats international patients will know how to optimize appointment schedules, reduce unnecessary travel, provide remote follow-up support, and coordinate treatment with your travel plans. For example, in some cases, the surgical phase can be completed within about 5 to 7 days in Vietnam, then the patient may return later for the final restoration after osseointegration. This can save a tremendous amount of time and travel expense. Finally, an ethical dentist will always tell the truth, even when the treatment is more difficult or takes longer. Because the ultimate goal is not simply placing an implant. The real goal is helping patients regain safe, stable, long-lasting oral function and confidence for many years. So, in the end, should you travel to Vietnam for dental implant from a professional perspective? Yes, absolutely, if you choose the right clinic. Because today, Vietnam truly offers many advantages: more affordable treatment costs, modern technology, highly skilled dentists, flexible patient care, and highly personalized treatment planning. If you are currently living abroad and still unsure about your missing teeth situation, you can start with a very simple first step. Send your dental photo or CT scans for an initial professional evaluation. A proper planned treatment from the beginning can help you save time, money, and unnecessary risks in the future. Thank you so much for watching today's video. I hope this information has given you a clearer and more realistic understanding of dental implant in Vietnam. And more importantly, no matter where you choose to receive treatment, always choose a clinic that prioritizes patient safety and long-term health above everything else.